we go.
Hi, everyone. Can you hear me?
Yes, Mayor.
Okay. All right, let's dive in. I can't see a lot of people here. And usually some of the folks here have their videos on, so just want to make sure that everyone, Kyle, I can see you. Can you hear me? If you could just nod your head if you can hear me, Kyle. How about this? Paul Bass, can you hear me?
I can hear you now. I couldn't hear you before.
Okay. All right. So let's start rolling here. Thank you. Overall numbers in Connecticut, we had an additional 557 positive cases yesterday, bringing the total statewide to 3,128. In New Haven, we have 119 confirmed cases now. We also need to correct previous information we put out. We have been saying that there's been 2 deaths. There's actually only been 1 death. We got information from the Department of Public Health and that was not fully correct. And moving forward, we'll confirm deaths with a death certificate to make absolutely sure that we're giving accurate information to folks, but we wanted to make sure that we corrected that information. So there's only been so far 1 death in New Haven related to COVID-19. As probably people have seen, Southern Connecticut State University is being set up as a field hospital with 250 beds. It will be a surge site to allow the hospitals to focus on COVID-19 patients. And currently the goal of this site is to focus on non-COVID patients to alleviate some of the pressure on the hospitals. My understanding is that the National Guard and Army Corps is working to set up the site today. Or I'm sorry, the National Guard is working to set up the site today. It's possible that there may be a military helicopter coming in tomorrow to make some deliveries as well. On the homeless shelter side, so the state's working to significantly reduce the number of individuals in shelters. And basically the state is looking to close most of the homeless shelters and move the population into hotels. That's being done pretty proactively, and it's possible that even as early as tomorrow, we may see a lot more homeless individuals moving to hotels rather than locating at homeless shelters. As people know, we have been working to transfer individuals to hotels to reduce the number of people at the shelters. The state wants us to do more and basically work hard to actually close the homeless shelters and make sure that individuals are separated even more. I have one update on Bella Vista. So Bella Vista, they actually are opening the store up. There was some concerns by residents. Bella Vista had closed the store that some residents use to have access to food. They're going to be opening that up and providing delivery services to residents so that they can have access to food. And they will be communicating with the residents on that. And they've also started up with CT Transit, or they will be starting up. I'm not sure if it's actually gone into action. The bus routes to go back to the previous site up the hill. They won't be doing transfers at that site, but for residents that are coming to and from Bella Vista, they can access the previous bus station to make it easier for them to get up the hill. I don't think I have any other major updates. Does anyone else on the team have anything that they want to add? So I'll open up to questions. So let's go with Kyle and then Paul.
Wondering if there's any update on the first responders that were waiting for test results. There were 8, I believe, that were still waiting.
I don't believe we have any updates. I think we still have not gotten test results. Chief Alston, can you verify that, or do you have any updates?
That's correct, Mayor. We still haven't gotten any new updates since yesterday. We're working directly with the health department, attempting to put pressure on the labs to get that information back.
So my understanding, to get into a little bit more detail why there's such a delay, the hospital sent the tests to a facility that was recently opened in Virginia by Quest. And that facility got totally overwhelmed with requests. And so that facility in particular, where the test samples are for our public safety officers, is moving particularly slowly. We're obviously very anxious to get the results of this, both so the officers can have a better understanding of their situation. And of course, we want to make sure that the officers and firefighters get back to work as soon as possible as well. Go ahead, Paul.
Thank you, Justin, and good afternoon. I hope you're all doing okay. I was thinking about event tracing. So your staff has spoken in general terms about how when someone's infected, you're tracing stuff back. And we've all heard about certain events where it seems like a couple of people attended. They don't know if that's where they got it. And today I've heard about an office where a healthcare worker worked and the other people haven't been notified. Can you share with us any specific events or workplaces that you've been noticing infections and that you've been tracing them to other people so the public can have more awareness?
Director Bond, you want to take this?
Hi, hello, Paul. Thank you for your
Hi,
question.
Marcy.
So your question is regards to contact tracing. What I can talk about is the process of how we handle contact tracing. So in the event that we are notified of a positive case, whether it is a healthcare worker or not, any individual tests positive, we then investigate the matter, contact the individual, and begin an interview process that consists of a number of things. One of them consists of asking where they were exposed, whether it was a workplace or another setting. And then we have follow-up questions asking for other contact information, and then that contact tracing begin with expanding the number of individuals that will be part of that interview process. So, and then we will provide recommendations based on a number of variables that consist of a prolonged period, provide recommendations for isolation and follow-up. And so that's how we, in general, are following contact tracing. Regardless of who the individual is, if it's as long as we know that it's a positive case that comes in, we handle them accordingly. If an event that it's in a workplace or in a unique setting, like we had earlier on with the untimely death we had in the city of New Haven, that expansive list can then be a co-investigation with the employer that we partner with their medical officer or someone within the facility so that we can work together and really ensuring that we have all the employees that had any, we call it the line list of employees that have been involved in that process.
And I understand that you deal with HIPAA and you deal with sensitivities about people feeling a stigma around it. I'll tell you what prompts my question. So today we interviewed one person at Yale New Haven who's very sick with it, and she doesn't know where she got it. So she went to one event we've had our eye on at March 15th, where there were hundreds of people, a very small room, and a number of people have gotten sick. So people who attended the event have not heard that people got sick. So I'm wondering that they don't know though if that's where they got sick. So at what point does it serve the public interest for us to know about that event? Or for instance, there is an elected official in town who doesn't want it known. Is it important for that person's constituents who had been at events with that public official to know, is there sometimes a public interest in having more of this information out there while totally respecting what you're dealing with people's privacy?
Correct, and I think you bring up a good point. If we were to interview and it involved a large event, that would give us cause to ensure that we provide information to the public. it's important that as you're gathering information, we have to vet out all the information that we're receiving, make sure that it's factual and not presumptive in regard to whether the person was actually positive or not. And so we have to filter all through the information that we receive to make sure that it's factual and cross-reference with positive laboratory results.
I'm not exactly
you.
sure the instance you're talking about, Paul, but I would imagine if there's 100 people at an event, there's not going to be as much of a HIPAA violation if there's so many people that it's very difficult to pin down the specific person that might have a medical issue related to COVID. So my sense is that if there's an event like that, and it sounds like you know some information that I don't know if our health department is aware of it. I'm not
Your health
aware of it.
department does, and the problem is you can't prove, your health department doesn't know. The problem is you can't prove that people necessarily got it there. You know what I mean? I think these are tricky questions, so I wasn't asking it as a gotcha. I do think that you guys are dealing with pressures on all sides. I just wonder sometimes, because of stigma that's felt in certain communities, whether people's lives are at risk, not just in New Haven, I mean everywhere, because the word isn't getting out, because people aren't as proactive about it. But I understood the example that the health director just gave, where you had an employer, and I'm guessing, I think what you were saying was, in that case, and we've identified as telehealth, and I understand you can't, they were able probably to notify everybody who works or who came into that facility. So it seemed to me there was not a need for a public announcement of that on your end, because you could probably reach anyone, although those people do interact with other people. So I understand these are tricky philosophical questions.
I think I now understand what you're talking about, and I think our team has made an assessment that individuals that should know are aware of the potential danger.
As much as possible. And, it's important that we understand that we are a community spread, and we continue to provide messaging on the importance of really practicing social distancing, limiting exposure in multiple group settings, et cetera. So it's really important that to your generalization, Paul, that people really have to adhere to the recommendations that are provided on a daily basis in regards to reducing their risk of exposure.
And is the Board of Alders on board with you? Like if they find out that someone in their ranks got it and they went with a whole bunch of people to a political conference, are you guys all on the same team of when it's important to let the public know that?
I can't say that we have specifically taught, so I have a daily call with Board of Alders leadership and a separate call with the president of the Board of Alders to bring them up to date on what's going on. We have not had a specific conversation about when we should or should not share information with the public. If there was a particular alder or a group of alders that were at risk, we would communicate that information to them.
Thank you.
Similar to anyone else in the public that may have been exposed, and we think there's a significant risk to them.
Thank you, Jess.
Agreed.
You're welcome. Other questions? I see Mr. Bingham's hand is up. Go ahead.
Can you hear me?
We
Can you hear me, Mr. Mayor?
Yes.
Yes. Oh, good
Yes.
afternoon. I had a question about the relations between City Hall and Woodbridge Hall don't seem particularly good right now. And while this is a 300-year saga, the COVID-19 crisis has kind of been a flashpoint for this. And when I asked you on Saturday if you talked to President Salave to see if we could clear the air somewhat, and you had not on Saturday, and I wondered if you had since then, because it seemed like conversation between human beings might help to bring some sort of constructive accommodation about.
So I have spoken with President Salave. I'm trying to remember. I'm sorry, I don't remember when you asked me and when that specific call with President Salave was, but I did speak with him after the Yale had the announcement of the 300 rooms becoming available. And I agree with you.
I think that was Saturday.
I agree with you that conversations between human beings is always a good way to address any differences.
Could you tell us anything about how that conversation went?
I think we had a cordial conversation where we talked about some of our potential differences and emphasized that it's important that we work together.
Thank you.
You're welcome. Other questions? Go ahead, Kyle.
I know we talked about this in the beginning. Could you just recap some of the efforts to move the people experiencing homelessness? I know in the beginning, you said that there were 24 hotel rooms across the city. Have you gotten more to accommodate moving them out of the shelters?
So it's complicated, but basically our approach to supporting individuals that are experiencing homelessness, I'd put into 3 groups. The first group is asymptomatic people that we want to make sure aren't forced to stay in an environment where they are all too close together. And with that group, we're using hotels. The second group is individuals that may have been exposed or are symptomatic, but we do not yet know if they have COVID-19. And we're working on a strategy to provide housing for individuals that are in that category where they're able to be separate from one another. Because if they're together and some of them have COVID-19, but others don't, we don't want them to spread this with each other. The third category is individuals that have tested positive for COVID-19 that are experiencing homelessness. And they can be grouped together because they all have COVID-19, so they cannot give it to each other because they have it already. So the first group is hotels. Second group, we're working on a strategy. And the third group is what we've been talking about with career high school, that we're getting closer to being able to staff. Now, in the first group, the hotels, the city secured 24 rooms and have 2 people per room. Again, these are seemingly healthy individuals that are asymptomatic. The state has added enough rooms to bring it up to 84. What's 84 minus 48? That's the number of rooms that the state's added. And the state, we've requested that the state provide rooms for another 300 individuals. The state has ordered the cities to basically close the shelters. And so their strategy is to provide support for another 300 or rooms for another 300 individuals. That will happen pretty quickly.
Okay, so they added 84 and they're going to add an additional 300.
So currently there are 84 individuals that are in hotel rooms.
Oh, okay.
That's a mixture of hotel rooms that the city has secured and the state has secured.
Okay.
We are asking them to add enough hotel rooms to accommodate another 300 people.
Okay.
I can't tell you if the state has agreed to that specific number. I know the state is interested in facilitating not just New Haven, but many communities around the state implementing this program. And so I presume that they will help us try to hit that goal.
Okay. And you were saying that they wanted them closed. And you might be able to get that done by tomorrow?
No, I'm saying that the process, we anticipate the state helping us start to facilitate that process potentially as early as tomorrow.
Okay.
But like many things, these things take longer than we often think. And so I'm always reluctant to say yes tomorrow because it may not be tomorrow.
Okay. Thank you.
You're welcome. I saw Paul had another question.
Yeah, is there anyone else in line? I don't want to.
I don't think so. I don't see other hands raised.
Okay, well, a suggestion that one person involved in politics offered to me today on the radio was landlords, like he's a small landlord, he has a house and his tenants are great tenants and they lost their jobs in the food industry so he can eat the rent for a while. He wondered whether the city could forgive taxes for landlords who temporarily forgive the rents of tenants
And your question is, can we do
What do you
that?
think?
I'm really reluctant to say that we can do that because we are facing very, very dire budget situation. And we're uncertain of exactly how this crisis is going to impact us from a budgetary perspective. I think that we should consider a lot of these options, but it's difficult for me to say that that's something
I'm
that
wondering if instead, because there's also mortgage cost, is there a way maybe to set up a rapid response team at the Community Foundation United Way Community Fund where there are already millions of dollars, where there could be rent payments paid for people who can show they've lost their jobs, coronavirus? I wonder if that could, I guess that's not your wheelhouse, that's theirs. Yeah.
well, it could be something that we request too. It's
Thank you,
something
Jeff.
worth looking into.
Yeah.
Thanks, Paul. Any other questions? I'm going to unmute Mary O'Leary because she usually has a question.
Hi, Mayor. I am here. Can you see me? Can you hear me?
We cannot see you, but we can hear you.
Yeah, I know the video didn't come up. I guess I just have, I think all the questions really have been answered, but once people get moved out and, 300 of the more homeless people go into hotels, will it be public where they are, where they're going to be?
I don't plan on releasing that information. And the reason why is I think that the people that are going into the hotels need to go through a process. And we don't want a lot of people just showing up at the hotels and trying to get rooms. So we don't anticipate, I don't plan to release that information. I'm not sure what the state will be doing.
Okay, and I just have one more question. I guess there was only, one firefighter has been definitely cleared, that he doesn't have COVID. I don't quite understand. I think the fire chief yesterday said that he will wait out the 14 days. If that's the case, I don't understand that. Why not go right back to work if you've been cleared?
I can answer that. So there's a return to work process that is being worked out with labor so that it is consistent across public safety. There are others who have been cleared, and we are making sure that that incubation period, I'll give you an example. One of the public safety officers, the 13th day, developed symptoms. So even though the test came back negative, we are concerned about the incubation period. So we're being very cautious about returning people to work.
Okay, thank you.
And
I
the
think in
question
general,
was-
this is a really tricky thing that we're trying to figure out. I know the chief has something to add, but in my understanding is that when people are symptomatic, they're much more likely to test accurately. If
Mhm.
they're not symptomatic, they may not test accurately. And so it's a challenge that we're going through because we want people to get back to work if they're healthy. And if you test people too early, you might not get a fully accurate result. And so it's just something we're struggling with. I saw Chief had something else you wanted to add.
Yeah, we're also handling those, Mayor, on a case-by-case basis, because again, we cannot determine whether the exposure was from work or from off-duty. So that's still part of that contact tracing process as well.
Okay. I guess I might have a question about the getting back the results and getting them back quicker. I talked to some people at Yale yesterday, and they're trying to use other facilities rather than just Quest. They're going to use the Mayo Clinic and actually start testing themselves. They already do testing for their own patients and personnel, but they were going to do another method of testing. So I was wondering if you've talked to the hospital about that.
Yeah, so the hospital shared with us that they're basically the same information that you have, that they're trying to find a variety of different ways to facilitate faster testing. And it's something that they're concerned about, as are we, because in particular, their employees and first responders being tested quickly and getting the results quickly is critical to us being able to respond to this crisis.
Okay, thank you.
Any other questions? Going once, going twice. Thanks, everybody. See you tomorrow.